Welcome, everyone, and thank you for another great episode of Talking About PHI. This is our limited series, Women in Healthcare. You know, one of the things Sue and I are very passionate about is PHI, protected health information. And in the wake of the changes, the overturning of Roe v. Wade, we know that there are important things that you need to be thinking about today in order to, focus and help protect your reproductive care and the information in your medical record. So, luckily we have Sue, who is an expert in the compliance area of healthcare. So she's going to give us some great insights. She's been doing some research. I've been doing some research. And so I'm going to ask some questions, and Sue is going to provide some great insight, and hopefully it'll help you start thinking about your PHI and what you can do. Sue, before I start asking you any questions, any thoughts you want to share?
Well, I wanted to say we have as our podcast Talking About PHI, and that P can be, I want everybody to think about it as your personal, protected, private health care information. So yes, we're going to talk about some things that are within the laws around there, as well as some of the other things to consider that we've kind of found in some of our research. But we wanted to do this to kind of offset some of the things we've been seeing in the news and all the different talking heads that don't necessarily understand what the law says, what's going on. And a lot of people have some assumptions out there we want to clear up.
Exactly. I think where we might want to start, Sue, is why did overturning Roe versus Wade make us have to think differently about privacy, especially for women? Why did that spark that thought?
Well, there's been a lot of discussion out there about some of the laws and what women who may decide that they want certain kind of care, they may go to another state. And again, I'm not just talking about abortions, which is part of it, but there's a lot of different care now within healthcare that's being looked at. And with that, and some of the incentives that some of the states are putting in for private individuals to be looking for people or that are either getting an abortion or aiding somebody else, or all of those different types of things, there's a lot of new incentives to go get information that may not have been as high of a risk as before. So there's certain things that the way some of the laws may be written may be impacting some of the long-standing laws. So there haven't been very many changes to healthcare release of information laws for 20 years. We have a lot pending right now with interoperability and some new HIPAA proposals. But this is one of the things that some of the ways the laws may be written may contradict what's in HIPAA, and may take a while for everything to work its way out, because there's a lot of the trigger laws going into place, a lot of those types of things that are impacting documentation, some of the access, that type of thing. So that's where I think that some people are making assumptions based upon the new laws about what they can and can't have access to. That may be incorrect.
I think ultimately it's about privacy of your information, right? Because when I go, it's like pre-Roe v. Wade, right? I felt like I had a little more, and I don't know if it was true or not, because third-party apps and things, which we're going to get into, were going to have access to more medical information. But you almost had more of a sense of that your privacy and your information was your information as an adult person making decisions with your doctor, with your husband or wife or partner or whomever about what's going to happen and how your family is affected. And it seems like the privacy aspect has shrunk down a little bit. So with regards to that, right? And if you're thinking about it, what should women think about with regards to privacy today, post Roe v. Wade, that they probably didn't think about yesterday?
So first of all, let's hit what the law still is. So I will say that recently, in the last week or two, the Secretary of the U.S. Department of Health and Human Services, HHS, did put out a statement, and I wanted to read this statement. Quote, how you access healthcare should not make you a target for discrimination. HHS stands with patients and providers in protecting HIPAA privacy rights and reproductive healthcare information. Anyone who believes their privacy rights have been violated can file a complaint with the OCR, as we are making this an enforcement priority. So what HHS is basically saying is our laws haven't changed, but I think they're recognizing that there may be more of a risk and more of a lack of understanding. So women need to understand that, first of all, if you think that a healthcare provider is releasing information that they should not be, that you have the right to file a complaint and have that looked at. So what's happening is that federal law has not changed when it comes to protection, but I do want to kind of hit with everybody just a quick side note of what does HIPAA cover. We had a lot of questions that we talked about in the some previous podcasts about with COVID, because a lot of people misunderstood, saying, how can a restaurant ask us for our vaccine status, or an airline, or all of that kind of stuff? That's our HIPAA private information. That's not exactly how it works. So what HIPAA is its privacy requirements, privacy laws for covered entities. Now, what the heck is a covered entity? A covered entity, and who HIPAA applies to, is basically whoever provides actual health care, such as a doctor, a hospital, a nurse, a lab technician, anybody that works in a hospital. It's also for your insurance companies and the people that work for your healthcare insurance companies. All of them are required to follow HIPAA privacy, but nobody else. So if you have information that's your own information, that's not covered under HIPAA. That's different. That's where you can decide, working with whomever, what information you want them to have about you and what information you don't want to have. But along those lines is you need to remember that if you give some of your personal information to somebody who is not a healthcare provider, such as an attorney or an adoption agency or anything like that, that information is not covered under HIPAA. There are no requirements to keep that information private. And that goes along with people that work with the hospitals or the providers. So we have what we call a business associate. So the other people that it does apply to are any companies that provide services on behalf of a covered entity, and they're using patient information, they have access to it, if they have what's called a business associate agreement. Now, our problem with some of this, and we're seeing more and more of, that some places don't have those agreements. So Kat and I recently talked about one situation we were reading about where some lot of healthcare organizations hired a third party to take their appointments for them. So when you would go in to do the appointments, it asks you all kinds of personal information, your insurance information, your date of birth, maybe your social security information, all of that, including why do you want to be seen. And without that business associate agreement that they say, we will keep this information quiet and we will follow all HIPAA guidelines, they don't have to. So that's some of those things we want to make sure that everybody understands. First and foremost, a healthcare organization is supposed to follow HIPAA laws and keep your information private. Okay, and then anybody that they have an business associate agreement with must also follow federal laws. But they don't apply in a lot of situations.
So that's where we get the concern, because you hear people talking about, oh, you have to delete your menstruation cycle app, or you have to watch your searches and so on. And that's that whole thing about your data being out there that's not covered by HIPAA. So it's out there and available. And in some states, and some other states might be following it. I believe right now it's in Texas, Oklahoma, and Ohio. I have to confirm that, but definitely Texas, where you have people that can apply civil suits against people that are seeking an abortion. And if they win, they get $10,000. So they have this incentive. So in order to prove their case, right, the plaintiff can then start doing a search on your woman's private data that's all out there, and different aspects. So if you can kind of talk about the third party apps, and then maybe give some insight to what people should think about as they are going about their day to day, that they weren't thinking about yesterday, that they're thinking about today. So what are your thoughts there?
So yeah, exactly. HIPAA does not apply to the WebMD website. It does not apply to your Apple Watch healthcare tracker. It does not apply to any apps that might be tracking your menstrual cycle. It does not apply for you searching online for any kind of healthcare needs whatsoever, looking up anything. And it does not apply even to the apps that may show your location. So I use an app with my husband so that I can track exactly where that guy is at all times. I can see how fast he's driving. I can see where he stopped to see, oh, I can see you're at the grocery store. Can you also pick this up? Okay. So
It's done out of love, Sue. It's done out of love.
It is. So we can see that with each other, but so can anybody else who gets into that app. If somebody wants to see who took an Uber to a certain location or who drove themselves to a certain location, and that location happens to be the next state's over an abortion clinic that's there, they can find that stuff. So we, Kat and I, are not experts on IT by any means, but we understand, and what I want everybody else to understand is those kind of things are not protected under HIPAA or under anything. That's why when you go and search for certain kind of bed sheets you heard about and you want to see how much they are, and then suddenly you get into Facebook and there's an advertisement for those same exact bed sheets and you see them over and over and over again, that's because the systems are tracking what you're looking at, and they're selling data across. There's no privacy laws about that data.
Yeah, and many times you're giving permission without thinking about it to those apps by what you're clicking. You know how many times it comes up and you're like, accept, accept.
Yeah.
And you have to be more vigilant accepting those little things and then learning how to turn them off on your phones.
Yeah. And I will say there's a lot of really good YouTube videos about how to do that for your particular phone. You can change your privacy settings, and I'm going to say men, women who aren't pregnant, anybody else, you may want to go in and look at all your apps and figure out exactly what privacy statements you have and don't, privacy modes you have and have not selected within all of your different apps. But keep in mind that at this point, all of that can be sold, and you have a lot of people that are going to be tracking. And right now it can be, and everybody needs to recognize that some of the changes that have occurred because of it is going to impact women who want to have babies, who are very excited about their pregnancy, but something goes wrong. And within that, there's a lot of changes in the decisions. Lawyers are being brought in to decide which method you should have of dealing with maybe a miscarriage or that type of thing that occurred. So there's a lot of stuff that you may not think might impact you that may. But what I'll say with all of this is when you're sick, when you have a condition of any sort, you don't want to be thinking about this stuff. So just make sure that you know kind of how that privacy works and kind of what steps you can take now just to have that awareness as you go forward.
Yeah, I think about it, and I think about all this added burden that women are going to have to take on in order to ensure that they have optimal control of their private information. And it seems like a lot of work, but I think in the long run, and it has nothing to do with avoiding, it has nothing to do with trying to circumvent anything. This is just about keeping your personal information as private and secure as possible so you are in control of who gets that information. And that's what I think mostly what we're trying to share here. As people that have worked in the area of and associated with PHI, keeping someone's private information from a covered entity and a BA and organizations that have BAAs, they work so hard to keep your data private, so hard to keep it protected. So this way you don't have hackers going in and taking your data. As women are going to have to take a more active role because now anywhere outside of those areas, it's more likely that it will become more inviting to hackers or people that are looking for that information and so on. So it's just a matter of protecting your protected health information, your personal health information, your private health information. So this way you are in control of who gets that information. So we talked about how people think that HIPAA is the ultimate in protection. You talked about the fact that it has to do mostly with covered entities and people that have BAAs. We talked about just a few things people can do, but what else would you suggest that women need to think about, Sue, with regards to keeping their data private? Any last thoughts or any really good nuggets of information that we can share here?
Well, one of the things that I've heard quite a few people talking about, so I want you to keep in mind too, is as you're searching for healthcare providers or looking at who can meet your needs. And remember, this can be any condition whatsoever. Be careful of the fake websites that are out there. There's a lot of fake websites that are using information to bring you in. And it might be that you're looking maybe for, say, even weight loss surgery or something to that effect, that they may be bringing you into something that they want to put you on some kind of pill or whatever, and they're trying to pull you away from actual healthcare providers, but looking like they are healthcare providers. They're not under HIPAA requirements. They're not under FDA. They're not under anything. So that applies for any kind of healthcare, anything. Make sure that you really do truly have the right website that you're looking at and you're not just finding something that's coming up quick. Now I'm going to say and put out a thing for all of our listeners that are working in healthcare. It's time to be even more diligent in protecting patient information than you have before. So you're still under HIPAA requirements. You still must have those protections in place. But there's a lot of people that may not be thinking of some of the impacts that are going to occur in our systems because of these changes in the laws. So number one is keep in mind, you may have new laws passed within your state that contradict HIPAA, and it's going to have to be worked out. And you may need to bring in somebody that's going to say, here's what you need to do at this point. Okay, so keep in mind that there may be a need in some situations. Along those lines, as you may have more people, if some people are filing complaints or suspicions or trying to turn in their neighbors or whatever, there may be more law enforcement involvement, and you may have law enforcement show up at the door of a clinic or a hospital or a physician office asking for records that may not even have anything to do with reproductive health. Could be another area whatsoever. Know your laws, because in most cases, if you have a police officer show up, 99.9% of the time, that police officer can't take any records without a whole lot of written stuff. Okay, there's only certain circumstances that they can have any records, even if they say, which as many times as I've been threatened to be taken to prison for or taken to jail for impeding an investigation, there are no rules that allow for that, but they can be very, very intimidating. So know your laws ahead of time of what they need to have to be able to take any patient records from you whatsoever. And then very, very importantly, remember, there's a huge incentive now for hackers to get into the healthcare system. We've already had a lot of hospitals that the hackers got in and what they wanted money. They were holding the information hostage. We've had that with a lot of healthcare systems. But a small physician office in the past has not necessarily been a small clinic or physician office, because they haven't been where they think the big bucks are. So that hasn't necessarily been a problem, but now it might be in certain circumstances to try to get patient information where they can go through it and try to figure out something that happened. So the last thing I just want to state too is just remember now, and this is for the physicians and all providers. So this is the physicians, nurses, MAs, et cetera, document well, document precisely what's going on to protect the patient, to protect yourself, so that is very evident in the records what is going on with the particular patient. Okay, make sure your documentation supports what's going on. There's not a lot of area for misinterpretation in there, so be careful of that. But overall, trying to think, looking at my notes to see if there's other things. I have written a very long article that has a lot of this information in more detail with the reference sites that we will post along with this. So you can go in and get more detailed information about where to find what we're talking about to support you legally. Because there's nothing worse saying this is the law, but I can't find it to show them.
Exactly. Well, Sue, I think that covers most of what we wanted to touch on today. The whole goal was to just share information to help folks know that in the wake of overturning Roe v. Wade, there are some privacy issues that are affecting women that you need to be aware of. And I think knowledge is power. And we're just trying to impart a little knowledge so this way your information is protected and that you know. And this is just the beginning. There's so much more information. We're just trying to help provide some awareness. And as we get more information and more data, we'll post that and share it. That's all we have for today. So any last words, Sue? I think that this is a great conversation.
If you have any additional questions or comments, please leave them below on our YouTube or in our LinkedIn and that type of thing. And we'll be more than happy to try to come back and try to answer some of those questions, and make sure to like and subscribe.
Awesome. Thank you. We look forward to talking to you all again. So until next time, take care.